Hello, good day everyone. My name is Jocelyn Shandy, and today I will be presenting my project entitled Image Filtering and Enhancement in Digital Radiography. This project focuses on improving the quality of digital radiographic images using two image processing techniques, namely Gaussian filtering for noise reduction and contrast limited adaptive histogram equalization or CLAHE for contrast enhancement. This presentation consists of introduction, objectives, literature review, methodology, result and discussion, conclusion, recommendation, and finally the references. Digital radiography or DR has replaced the conventional film radiography with digital detectors, allowing images to be acquired quickly and processed digitally. However, digital radiography images are still affected by image quality issues such as random noise and low contrast, which can reduce the visibility of the important anatomical structure. Therefore, this project applies Gaussian filtering to reduce image noise and CLAHE to enhance the local image contrast. The importance of this study is that improving image quality can increase diagnostic accuracy without increasing the patient radiation dose. Better image quality also improves workflow efficiency and reduces the risk of misdiagnosis. The main problem addressed in this project is that the DR often suffer from poor image quality. So this study explores the image filtering and enhancement technique and compares the visual differences between the original and also the processed image. The general objective of this project is to evaluate the effectiveness of the image filtering and enhancement in improving the DR image quality. The specific objectives are first, to identify the common quality issues in DR, second, to describe the Gaussian filtering as an image filtering technique, third, to describe CLAHE as an image enhancement technique, and lastly, to compare the visual differences between the original and processed radiographic images. And the expected outcome is to produce higher quality radiographic images with better visualization of anatomical structures and improved image interpretation. This project is based on several important concepts. DR is a modern imaging system that uses digital detectors instead of film. Image quality is an important factor because it directly affects the diagnostic accuracy. Image processing in DR consists mainly of two stages: image filtering to reduce noise and image enhancement to improve the image contrast. So for this project, Gaussian filter was selected for image filtering while CLAHE was selected for image enhancement because both techniques are widely used and effective in medical image processing. The processing sequence begins by applying the Gaussian filter to reduce random image noise. After the noise has been minimized, CLAHE is applied to enhance local contrast and improve the visibility of the anatomical structure. Performing noise reduction before contrast enhancement is important because it prevents noise from being amplified during the enhancement. As a result, combining these two techniques produces clearer, higher quality radiographic images with better diagnostic value. Previous studies support the use of these techniques. Research by Seram and Barsberg reported that provide faster image acquisition, a wider dynamic range, and allow post-processing. Gonzalez and Woods explained the image noise and poor contrast reduce diagnostic accuracy and also described the effectiveness of the Gaussian filtering in reducing noise. Meanwhile, study by Zuidelver and Reza demonstrated that CLAHE improves local contrast while minimizing excessive noise amplification, making it highly suitable for medical imaging applications. The methodology of this project involved using chest radiograph images. First, the original image was collected. Next, Gaussian filtering was applied to reduce image noise. Then, CLAHE was applied to enhance image contrast, and finally, the processed image was compared with the pre-processing image to evaluate the improvement in the image quality. So, the overall workflow consists of image collection, image filtering, image enhancement, image comparison, result analysis, and conclusion. The findings show the Gaussian filtering successfully reduced image noise and produced a smoother image appearance. After applying CLAHE, the local contrast increased, making the anatomical structures such as lungs, ribs, and heart borders much clearer. So overall, combining these both two techniques produce a noticeable improvement in image quality compared to the original radiograph or pre-processing image. This comparison summarizes the improvement after image processing. The pre-processing image contained a higher level of image noise while the post-processed image shows significantly reduced noise. Image contrast improved from moderate to much clearer. The visibility of the anatomical structure also improved, allowing finer details to be observed more easily. Overall, post-processing enhanced image quality and supported better diagnostic interpretation. In conclusion, DR images are susceptible for image quality issues such as noise and poor contrast. Gaussian filtering effectively reduces random image noise while CLAHE enhances local contrast and improves the visibility of the anatomical structure. The combination of these two techniques successfully restore image quality and produce clearer radiographic images that can assist in more accurate diagnosis. For future work, several improvements can be considered. First, use a larger dataset to improve the reliability of the finding. Second, compare Gaussian filtering with other filtering techniques such as median filter, bilateral filter, and Wiener filter. And thirdly, compare the CLHE with other enhancement methods, including histogram equalization, additive histogram equalization, and deep learning based enhancement technique. Finally, involve radiologists and radiographers in evaluating the process image to determine their clinical usefulness. For this project, the information and concepts were supported by several established textbooks and journals in DR and digital image processing. So these are the references that provide the foundation of the image filtering and enhancement technique that I discussed throughout this whole project. And that concludes my presentation. Thank you so much for your time and attention. I hope this presentation has provided a better understanding of how image filtering and enhancement in DR can improve the quality of the images and support more accurate diagnosis. Thank you. Have a nice day, everyone.